Now we look at scoliometer measurement. So scoliometer measurement is one thing that I actually use to pick up scoliosis. Okay, scoliosis, like, alright, so I actually try to confirm scoliosis, using it, Then we also have the X-ray. So I'm doing an X-ray to also measure an angle which is known as a Cobb's angle. Okay, the Cobb's angle. Alright, so let's look at the two of them. So the scoliometer measurement and the X-ray to actually measure the Cobb's angle. There are two key tools that clinicians actually use to confirm scoliosis. So what's a scoliometer? This is a scoliometer. The person will bend forward. They now measure the angle. So it will also help you know the extent of the condition. So scoliometer is a handheld device. It's like a level. So it's used during Adam's forward bend test. So as the person bends, you measure. So the patient bends forward at the waist. So the scoliometer is now placed across the back of the area of the greatest rib hump of the lumbar asymmetry. It measures the angle of trunk or rotation. So suggests possible scoliosis and warrants that further imaging should be done. You understand? So for the Cobb's angle, X-ray to measure the Cobb's angle now. See, one, please, you can pause to observe, right? You can also pause to observe. You can also pause to observe. So it's a good standard. If I want to actually clinically confirm scoliosis, this is like the gold standard, So it will confirm scoliosis and quantify the severity. It will show you that this type of scoliosis at which level. So a standing posterior anterior spinal X-ray is taken. You identify the most tilted vertebrae at the top and bottom of the curve. So you draw lines along their endplates, then perpendicular lines. So the angle formed at their intersection, I see, is what is known as what? The Cobb's angle. Okay. So if it is less than 10, it's not scoliosis. 10 to 25 is mild scoliosis. 25 to 40 is moderate scoliosis. And 40 to 50 is severe scoliosis.